All right, so first we're going to start off with the anterior postural assessment. So we're going to look, are his feet parallel or shifted outwards? They look pretty good to me. Also, we're going to look and see if the knees are in line with the toes, and they look pretty on point here. So now we're going to look for the ASIS, and oh shoot, I don't know how to do this with the phone here. I hope that gets it. Watch out. So I'm gonna feel around in here. They're pretty good. Mackenzie, get out of the way. Sorry about that. Now we're gonna look, are his shoulders level or elevated? They look pretty on point to me. And also his head is level, not tilted forward, left or right. So turn to your side now. So now we're gonna do the lateral assessment here. His feet are, I noticed, going a little outwards. So there's that. His knees are looking to be in a bit of hyperextension here. I don't know if you can see that. Ryan, try and push your knee like backwards. Can you do that? Okay, now go back to normal. So he can hyperextend more, but it does look a little bit hyperextended. Also, his head is a little bit forward, yes. Turn around now, Ryan. Yep. All right, so your feet, they do look pretty good from the back view. Your knees still look like they're hyperextended a bit, but that's fine. Shoulders do look pretty good. Yeah, that's it. All right, so we're gonna start with the overhead squat assessment here. So put your arms over your head, yeah, straight up. So you gotta keep them in line with the side of your body, you know. So, now go ahead and squat. You can see the shaking in the knees there a little bit. Looks like he's coming towards this side a little bit here. Keep going, don't mind me. His feet are tilted outwards during this. All right, so I forgot to record from the posterior view, the overhead squats along with the single leg squats. So go ahead, Ryan. So you can see the shaking knees going in and out. And then at the end, it still looks like this one's going inside here. Hips, spine, head looks normal. All right, Ryan, go ahead, do single leg squats. Everything looks good. Actually, the knee's still a little shaky, but it's to be expected with someone who doesn't really do. I ran out of space on my phone, so sorry about the quality on this one if it's worse. But all right, single leg squat from the lateral view here. Everything looks pretty normal. Balance is kind of off, but again, that's expected. All right, now turn towards me and do it again. Okay, so this is the second part of the dynamic assessment. So here you can see the charts are filled out, just explaining what was normal, what was abnormal with, this was the overhead squat, for example, with the anterior, lateral, and posterior view, along with what was shown by the foot and ankle, the knee, LPHC, shoulders, head and cervical spine. So you can see these were mostly normal. These not so much. So Did the feet flatten or turn out? Yeah, they did turn out. The knees did collapse inwards. More specifically, the left knee did collapse inwards. So there was no excessive forward lean on the back. There was very little, if any, low back arch from my brother. Also, his arms did not fall forward, so that's good. Going into the single leg squat, we have the same setup on the chart. So most of these were normal as well, but there was some problems with his knees here, more specifically the left one. Let me change this here. It was his left knee that he was using and was shaking and going inside. So the knees did move inwards to answer that question, and he did maintain his balance, although he did stumble several times. So there's that. Now for exercises and strengthening stuff, stretches, all that to take care of these issues. So for the overhead squat, the overactive muscles were possibly soleus, lateral gastrocnemius, biceps femoris, more specifically the short head. So the soleus, pretty basic stretch. You just push up on a wall, take a step back, and push on the back of the foot that's backwards. You'll get a good soleus stretch in there. For the lateral gastrocnemius, you put your foot up on an elevated surface while keeping your heel on the ground. It should be about a 45-degree angle. And then you lean forward into the stretch and you will feel it more. Feel free to go for more than 90 degrees if you don't feel the stretch at 45, but I find 45 is typically the sweet point. So for the biceps femoris, the short head, you lay on your back with your legs on the ground. You bring one leg up straight so it's 90 degrees with the ground. You then pull your leg towards your opposite shoulder. Opposite shoulder meaning if you bring your right leg straight up, you pull it towards your left. So for the underactive, you want to strengthen and turn these muscles on. So the potential muscles that you need to strengthen and turn on here are the medial gastrocnemius, medial hamstring complex, gracilis, sartorius, and popliteus. Not sure if I pronounced that right, but for the medial gastrocnemius, you can just do calf raises, just up on your toes, hold for a second, back down. You can do this with weight or with just body weight. The medial hamstring complex, you can just do hamstring curls. You could do this on the hamstring curl machine, or there's band variations that you could use as well. So for the gracilis, you would do lying hip abduction. You can do this with or without a band. The sartorius, you can just do lunges, pretty basic there. And for the popliteus, just do quadricep extensions. So now onto the muscle imbalances for a single leg squat. The overactive, you want to stretch and make longer. The potential muscles there are the adductor complex, bicep femoris, the short head, TFL, and vastus lateralis. So for the adductor complex, you should do a lateral lunge. For the biceps femoris, lay on your back with your legs on the ground. Bring one leg up straight so it's 90 degrees with the ground, and pull the leg towards the opposite shoulder. Same one from the overhead squats. For your TFL, you want to be about a step away from the wall. Cross one leg behind the other with both heels on the ground. You lean in towards the wall with your hip for more of a stretch there. For the vastus lateralis, go into a lunge position and bring the back foot up behind you and grab it with your hands. So if you move that leg more away from your body, you'll get a better stretch on the vastus lateralis. That's that outermost quadricep muscle there. So the muscles that you that are underactive, you need to strengthen and turn on. That's the gluteus medius and maximus, as well as the vastus medialis oblique. You want to do for the glutes, you could do lateral band walks and side lying hip abduction. There's plenty of exercises for those, as well as the vastus medialis oblique. You can just do single leg raises. So that's it for this assignment. So I'll see you guys next time.